This video will explain how flashbacks and nightmares start and continue after a traumatic event. Flashbacks can be very frightening and cause us to avoid triggers to our upsetting memories. It is normal to experience flashbacks after a traumatic event. This video will explain why we experience flashbacks and help you gain more control over them in future. It will help you understand how your flashbacks started and suggest ways to manage them. This will allow more pleasant memories to come to mind in future. Flashbacks and intrusive memories are not uncommon after a trauma. This is because our brain deals with traumatic memories differently to normal memories, that results in them being stored in the brain in a particular way. For some people, a bereavement can be very traumatic. In particular, memories of your loss or the circumstances in which you lost someone may be coming back to you now, even though you don't want them to. Let's take a closer look at what that means. There are two memory systems in the brain that work in tandem. One is like a camera taking pictures of everything around us, like sights, sounds, smells, what we feel in our body, and our emotions at the time. The other is like a photo album that puts these pictures in an order that makes sense and sticks it on a page. Once we have turned the page, we know that that memory has happened in the past and can go back to that page by choice. During a traumatic event, such as losing your loved one, the brain's memory systems react in a different way. When our body is responding to a trauma, the blood flow to the camera part of the brain goes up, while the blood flow to the photo album part of the brain goes down. This increase in blood flow causes the camera to go off rapidly, taking pictures of everything around us and noticing how we're feeling at the time. This is because it's important for our brain to remember clearly all of the things contained in this traumatic scene, so that if we ever enter another similar situation, our brain can remind us that this is dangerous and we should leave immediately. Our brain doesn't always get it right, and it can keep reminding you of events that have happened in the past as a way of trying to keep you safe in the present. Our brain has not registered that it's no longer helpful to be reminded of these experiences. Because the photo album part of the brain has essentially been shut down, these snapshots have nowhere to go, so they float around unprocessed in our brain. This is why when we enter a situation that is similar to the one of the snapshots, or feel a similar emotion to the one felt during the trauma, the traumatic memory keeps popping back into our head. Naturally, when things make us feel bad or scared, we'll try to avoid them. So what ends up happening is that we try to avoid situations, places, or people that cause our snapshots to pop up, or we try and push them out of our minds completely. However, by avoiding our snapshots, they remain unprocessed, floating around in our brain, ready to pop up at the next available opportunity. There are a few things that might help you to manage your flashbacks. Sometimes just making an effort not to push our intrusive memories away can be helpful. This means allowing any images or thoughts to come to mind with a sense of acceptance. It can be helpful to tell yourself, that memory makes me sad or frightened, but I know it's just a memory. Alternatively, writing down your memory and going over it can help process your snapshots. Snapshots can come at any time in response to triggers in our environment. Sometimes a way of getting started is to start cataloguing the things you notice that act as triggers to your unpleasant memories. For example, Sarah noticed that every time she got in the car, she started weeping. She realised this was because she used to go for a drive to clear her head when caring for her husband during his illness. This can feel very scary at first because it means you allow unpleasant memories to come to mind without pushing them away. But this is the first step in putting your snapshots into the photo album. Another way of getting started, once you've become more aware of your triggers, is to focus on how the present moment is different from the snapshot that your mind is showing you. John would get intrusive images of his wife in a wheelchair every time he walked into his living room. He found it helpful to move some of the furniture around and change the positioning of lights in the room. This helped him focus on the ways in which the room was different now, as opposed to when his wife was ill. Most people say that this technique helps them to manage their flashbacks. However, for some, this may not work, and it will be too difficult to allow these thoughts or memories to come to mind. If this is the case for you, then it may be helpful to ask your GP to refer you to a clinical psychologist who can help you work through your memories in a more safe and gradual way. This video has explained how flashbacks and intrusive thoughts are processed and why they persist over time. Avoiding thinking about these intrusions will mean that they remain unprocessed. Try allowing your memories to come, even if they're painful. But if this feels too hard, consider seeking more specialist support.